Fine, thank you. So about 20 years ago, just a couple of years after I had qualified in medicine and medical sociology from this very building, I took a job in rural Bangladesh. And I lived there for a few years running a research program on the control of sexually transmitted infections. And what struck me as a good Guardian reading feminist as I arrived in Bangladesh was it seemed pretty odd to have a sexually transmitted infection program that was entirely focused on women, particularly when I looked around me in society and realized that it was men who had the ability to move around the country when women were often literally not allowed to leave their own homes. It was men who had purchasing power, who could go out and buy sex from sex workers. And it was men who had other kinds of power in that society, all of which put them at much more risk of STIs, including HIV, compared to the wives that they'd left at home. But still, the great and the good in the Bangladeshi government and all of the donors funding the health program decided that where their efforts should go would be on controlling STIs in women. So I have spent the ensuing 20 years really trying to understand what is it that links gender and health outcomes. And I want to present to you today some of the findings of some recent work that we've been doing, trying to understand the differences in health outcomes for men and women. First of all, it's important to understand what we mean by gender and how that differs from sex. Gender is the norms, the rules, the customs, the laws that govern all of us in every society in the world and dictate what it means to be a man or a woman. Sex is the biological features that you're born with. Gender norms are set early on in all our lives. Here you'll see a picture of my own daughter, who within 30 minutes of birth had been provided with a rather fetching pink hat by Connecticut maternity services. Gender norms are pretty universal, so if I show you this picture that I took at a market stall in Oman, you'll immediately know that the customers that this young boy is hoping to attract are other young boys to buy those kinds of toys, toy gun, toy cars, boys' toys. But it's also important to remember that gender norms are not fixed, so I apologize for the rather poor quality of these photos. You recognize me, I'm wearing gender-appropriate pink, and I'm talking to transgender sex workers in the slums of Karachi. So these are people who are born as biological males, but in their soul, they'll tell you they've always been females, and hence they live their lives as women. What I want to explore with you now is gender actually making us sick? Is there any evidence for that? I'm sorry to sound like a university lecturer, but I'm just going to give you one definition, and it's the definition that will hopefully make the next few slides more understandable, and it's what is a disability-adjusted life year. So it's a term that health economists like to use, and it essentially says it's years of potential healthy life lost because you die or because you live with a disability. And health economists like to gather DALY data on a regular basis and use that data to set priorities. Where should we be putting all of the world's resources to make us all healthier and hopefully happier? The most recent DALY data published at the end of last year are an enormous global exercise undertaken by thousands of health economists and epidemiologists around the world. When the data were published, the big headline news that made it into news services all around the world was that essentially the world's diseases are shifting. We've moved away from infectious diseases, and now essentially we're all going to die of non-communicable diseases. So a colleague from UNAIDS and I, Kent Buse, disaggregated the top 10 DALYs by gender. I've been very gender aware here and put the boys' figures, the men's figures in blue. So you'll see the top 10 DALI data is disaggregated for men. And here's the data for women. And what you'll immediately notice is that every single one of those top 10 is more burdensome in men than it is in women, to a ratio of 3 to 1 when we're talking about road injuries. What drives those DALI data? Well, risk factors drive them, the kinds of things that you've already heard about today. People smoke, they drink, they take risks with their lives. So if we disaggregate by risk, we see that, again, men are a lot more risky than women, and they have the DALI burdens to prove it, again, at a ratio of 3 or over 3 to 1 as far as smoking and drinking globally are concerned. Male mortality. One of the great things that's happened in development throughout the world over the past 40 years is that all of us can expect to live longer in every part of the world. But in every single country of the world, half the audience that are women can expect to outlive their male counterparts. But why? So here's your summary. Men take more risks, they get sicker, they die younger. Why? I'd like to suggest a couple of reasons. I think there's a multitude of reasons driving those gender differentials. This is a picture that I took last summer in Burma, and I think it represents a lot of what's driving the difference in the rates that we see between men and women all over the world. It's hard to name a country that doesn't perpetuate the idea to young men that what it means to be a real man is to take risks, to smoke, to drink, to be sexually available, to drive fast cars. And those kinds of ideas are exploited by big business, particularly the tobacco and alcohol industries. It's not just me saying it, these are the words of the Director General of WHO herself. If I show you this picture and tell you I took it in a market in Shiraz in Iran a couple of years ago, you'll immediately notice what we all think about gender and Iran. And I'm certainly not here to try and persuade you that gender inequalities are completely misunderstood in Iran. We see this picture, we think of gender-oppressed women. But hidden away in that picture, I think you'll just see the outline of the wheel of a motorbike with a group of men clustered around. Gender inequalities in health outcomes in Iran. This is a country where the rate of death on the road is one of the highest anywhere in the world. And my colleague, Dr. Hagparost in the Institute of Global Health with me, has calculated that essentially one person dies every 20 minutes. Whoops. 4 out of 5 of those deaths are in men, because women don't drive to nearly the same extent that men do, and they certainly don't drive as fast as men do, and they never drive motorbikes, or almost never. But it's also important to realize that what we see now, what those DALI data showed in 2010, will not look the same in 2020, let alone in 2030. As anybody who's been out on a Saturday night recently in any city in the UK will tell you, girls now act like boys did a generation ago. They drink, they smoke, they take the same kinds of risks that boys did. It's not just a UK phenomenon. You'll see headlines here from India, from China, showing that gender norms change. Does it matter? Yes, it does. This is a great paper from 2011, which essentially correlates gender empowerment along the bottom with the ratio of male to female smokers. And what you see, you can't read this at all, but you'll have to believe me that up in the right-hand corner, gender equal Sweden. Great gender equality norms, more women smoking than men. Whereas down here, bottom left-hand corner, Bangladesh, gender unequal, about 1% of smokers are women. So that's the evidence of the role that gender plays in all of our health outcomes. So how do those public institutions, indeed those private institutions that are charged with promoting and protecting global health, how do they deal with gender? Well, I'd love to be able to come here and tell you that the villain of the piece is the World Bank, but actually it's not. They're the institution that say everything needs to be gender mainstreamed. You need to treat gender according to equitable principles. WHO, in its overall strategy, does something very similar. Talks about gender-sensitive approaches to improving the world's health. But then when it comes to its actual gender and health strategy, it starts talking about the health of women. So then when we look at some of the other big players in global health, the US government, the Global Fund with its millions and millions, hundreds of millions of dollars to be spent on 3 infectious diseases, we see again that for these institutions with their big bucks, gender means the health of women. What about the big name in global health? What do Bill and Melinda think about gender? Well, unfortunately, we'll never know because they don't mention gender at all. Something that we've seen can drive 3 times the difference in health outcomes for men and women simply doesn't feature in any of the programs. So I hope that I've persuaded you in these few minutes that the answer to my obviously rhetorical question, is gender making us sick, is yes, it is. But it would be a very sad ending if I simply left it at that. I think that we need to take that answer and move on and say that in order to make health outcomes better for all of us, first of all, we need to recognize something that's very poorly recognized, not just in health, but in many other facets of society. Gender does not mean women. Gender affects each and every one of us in this room and beyond. Gender norms, cultural, are being exploited by big business to make profits and thereby make at least half of us unhealthy. Very soon, those kinds of exploitation will make all of us unhealthy. At the end of the day, these people in Udaipur and you people in this room have equal rights to health. That's a right that's been enshrined since the 1940s in UN documentation. Every single one of us, regardless of our gender or any other kind of social or economic division between us, has the right to health. And that's the right that we need to remember if we're going to achieve gender equality in health outcomes. Thank you.